We're talking about the coronavirus or COVID-19 tonight with Dr. Ferris Cotter, an infectious disease specialist, and Dr. Maria Brayman, the ARH Chief Medical Officer. Thank you both for being with us tonight to talk about this timely topic. A lot of people are concerned about this. So, Dr. Cotter, I just want to start with you kind of explaining what this is. What is COVID-19? And what are the most important things we need to know about it?
COVID-19, it's a virus. It's a novel coronavirus. It's an upper respiratory virus. We've known about coronavirus for a long time. Coronavirus is one of the most common cause of the common cold. And COVID-19 is a novel coronavirus. It's different than the coronavirus we have. It causes an upper respiratory infection. And for most of the people, it's a mild infection and they get over it. Sometimes it can be a severe illness in 15 to 20% of the cases, and sometimes it can be a serious illness in 5% of the cases.
I want to ask you right off the top here, you know, you hear complaints that the media is overhyping this, that it's not really as bad as it seems. What would you say to that? Are we overhyping it?
Well, it's a good question. I don't think we're overhyping it. It can be a serious illness. It's a new illness for sure. And I think we should know about it. We should take precautions. We should know about the new cases. I wouldn't say overhyping. We may be talking about it more than we talk about other illnesses. Yeah. But I wouldn't call it overhyping.
And I think a lot of people point to the flu for the overhype because a lot more people have died from the flu. A lot more people have been infected by the flu. So what makes the worry worse about this?
Well, that's a good question. We're going now in two epidemics at the same time. We have the flu season that's still ongoing, and we have the COVID-19 illnesses that are ongoing. That's true. There are more people that have died from the flu compared to the COVID-19, but the absolute mortality from the flu is around 0.1%. The absolute mortality from COVID-19 initially thought to be 2% from the Chinese studies, but now we know it's a lot less than this. There is a vaccine for the flu. Right. There's a treatment for the flu. So far, we don't have vaccine for COVID-19, and we don't have treatment except supportive care. So two illnesses going parallel to each other, and that's the difference right now.
As I mentioned, Dr. Brayman, there are 4 confirmed cases now in Kentucky, but none are in eastern Kentucky. Can you safely say right now there are none in the ARH system?
There's certainly none that we've diagnosed at this point. There have been some strict criteria on who is allowed to be diagnosed or who's allowed to be tested up to this point in time. And those have mostly related to travel history coupled with respiratory symptoms. Those indications are changing, and they're changing because what we're seeing in Kentucky and across the U.S. is what we call community spread. And that means as opposed to it being related to travel, people are catching it from some other members in the community. So we're changing the criteria for testing, and we expect to have more tests available and more people being tested who present with respiratory symptoms and a fever.
So, and the governor made this point this morning that some of the, if not all, the transmissions in Kentucky are person to person.
That's
probably
correct.
So it sounds like you may be testing more now that that's occurred.
That is correct. We anticipate that we will be testing more people. They will now qualify for the testing because originally the criteria were very strict and related to whether or not there was a travel history to an area that was endemic with COVID-19. That's now changed this week.
Yeah.
Yeah.
Tell me how ARH has been preparing for this.
Yeah, ARH has been very aggressive in their preparations, and I'll tell you that's because we have 13 hospitals in eastern Kentucky and southern West Virginia, 11 in Kentucky. We have 73 clinics, and we have 12 home health care agencies. So with that, we have a large number of healthcare workers, and it's very important that we we make sure that they're safe. You know, in Washington State, they weren't prepared when they were hit with coronavirus, and they had to isolate over 200 healthcare workers, and we really can't afford that kind of stoppage. So what we've done is we have prohibited, since early last week, since Monday of last week, we have stopped any travel between ARH facilities, between any of our workers. Any business meetings are supposed to occur now via telephone conferencing or web conferencing. We have now stopped any of our workers from traveling to any meetings outside of the ARH system. So we are trying to do that social distancing and very cautious preparing so that our workers aren't getting sick. The other thing we're doing is that for members of our staff that have traveled outside of the country to any of these endemic areas, or now on cruise ships, we are quarantining them from working for 14 days prior to coming back. So we are ensuring the health of our community and the health of our workers that way.
So are you saying that if, say, a doctor works in Hazard, they can't right now go to another hospital in the system?
So we've made some very specific exceptions to who can travel, and that includes physicians that do work in multiple facilities, so they are able to travel between facilities. But we have a number of other workers who spend time, their work consists of traveling from facility to facility, and we have prevented that travel from occurring. We've also changed our sick policy for during this time period. We used to require that there be a note if someone were out sick. We're encouraging our employees, if they have a temperature and upper respiratory infection, that they stay home, and they are not required to go into the doctor's office, because we're just trying to get people to self-isolate, to stay at home, and not to bring any illnesses into the office.
Are there any visitor restrictions right now?
There are. So we have instituted our visitor restrictions that are consistent with our flu policy right now, which basically is that if you have a cough or a cold, please do not come visit your relatives or friends. And we have posted those all over our facilities. We've also instituted some visitor restrictions in our skilled nursing facility, which is located in our Tug Valley region.
Okay. Now, I received a lot of great questions on Twitter and Facebook from people when I told folks that we were going to do this today. So I'm just going to run down some of those, Dr. Cotter, and if you can't answer them, just say you can't answer them.
That's fine.
One is, and I heard this morning in Governor Beshear's news conference, it seems like children are not getting COVID-19, or it's not spreading fast among kids. Is that right? And
so far that has to be the case. Children are getting less infected with COVID-19. We have to remember that children have a robust immune system, a very strong immune system, and a very strong immune system can overcome the virus. So we've known that before. And actually, to add this, men are getting more infected than women. Men have a weaker immune system. So we have to, this is early in the epidemic, we really don't know. But as observational studies so far, we've seen more adult than children being infected.
And of course, you had the nursing home in Washington State where there's been several deaths. So is this, I would assume this is more deadly among the older generation that maybe have underlying health issues as well?
That's a great question. So we have risk factors for who gets sicker than others, and patients who are elderly, because as we get older, our immune system gets older. It's called the senile immune system. So elderly and patients with heart disease, uncontrolled hypertension, lung disease, liver disease, kidney disease, patients with comorbid medical conditions get sicker than patients who have no medical illnesses.
Will this virus dissipate like the flu does with warmer weather?
We don't know. That the answer to that question is we don't know. Because there's no guarantee that this virus will dissipate with warmer weather. So the only way to answer this question is to wait and see. It might not. It might be an illness that we're going to live with for the next little bit. We don't know yet.
How can you tell the difference between other illnesses like the flu and COVID-19? Does it have to be from a test? Is that the only way?
By looking at the patient, you won't be able to tell. As Dr. Brayman alluded earlier, if somebody coming from an endemic area like Southeast Asia or an area that's infected with COVID-19, then you can suspect it. But in order to tell for sure, you have to do the test.
And I know there's been some concern about not enough testing kits. Is that an issue in ARH right now?
So the testing as of today is still through the state.
Okay.
Now that will change because commercial tests are becoming available, and we are working with commercial testing facilities to try and bring those online at ARH. And I expect by next week we'll have commercial testing available at our facilities.
One thing that's been affected tremendously is international travel. Yeah. You know, and then you hear all this talk about, well, the Kentucky Derby, some of the big events coming up, or are they going to have to make changes, the NCAA tournament? How far do you fear this will go? Do you think this is going to disrupt daily life considerably more than it is now?
Well, that's another good question. If the virus is endemic in an area or a town or a county or a state, and there is a major event planned, it's better for that major event not to happen. I'll give you an example. Italy right now is on lockdown. They locked down northern Italy, the main hub for economic development. The Pope from Italy decided to do his mass over the radio instead of going into the square where all the people are together. So this is case-by-case basis. If there is an epidemic and cases happening where the event is going to happen, it's better for a big mass gathering not to happen.
No.
Sorry, the only thing I would add to that is that our public health officials are telling us to warn our elderly people, those that are 60 and over, and those people with the comorbid conditions that Dr. Cotter mentioned earlier, that they refrain from going to any gatherings, even if it's not endemic in their area, because they're particularly vulnerable.
That include cruise ships and air travel for patients who have comorbid medical condition, because that's called mass gathering.
What about a shopping mall, an event at Rupp Arena? Is that something elderly people should avoid right now?
Back to the same principle. If there is an endemic disease in your state or your community, and you don't need to do what you have to do, stay home.
Okay. Are there any supplies the average person should keep at home right now in case there is an outbreak here? Anything they should have on hand?
Well, that's a tough question to answer, but basically basic needs. Basic needs like any disease state. You know, I mean, if you need to go to the grocery shopping every week to get certain supply that you know about, it's better to have them ready in case you don't want to be among people. And if that person gets sick himself or herself, as Dr. Brayman alluded earlier, they need to self-quarantine themselves, stay at home. So if you stay at home, then you should have some supplies to help you. Even work from home if you're sick.
Yeah. We've heard that it really doesn't help you to wear a mask. You know, we've heard these stories of people going out and buying these masks, and does that not really help at all?
Well, I'm going to answer this question, and I'm going to let Dr. Brayman answer it too. Okay. So there is a misconception about masks. The mask is not going to make you not acquire the COVID-19. The mask is going to help you not give it to others. So if you're a patient who is infected, it's better to wear a mask for not spreading it to others. But in order to protect yourself from other people, the mask by itself is not going to be the key, because the virus can transmit by droplets, and it can be laying on surfaces. It can come into your eyes, nose, mucosal surfaces, not only the mask.
Did you have anything to add to that?
I think he did an excellent job.
Okay. Well, how about everybody says wash your hands, wash your hands. Are there any types of soap or hand sanitizer that will not get rid of coronavirus?
Just wash your hands more than 20 seconds, or you can use the alcohol rubbing gel, but wash your hands 20 seconds or more. Don't touch your eyes, nose, or mouth, especially after touching something else. This is how the virus is transmitted.
And honestly, we should be doing this anyway.
Yes,
right.
Yes, we should do, but it's good time to emphasize about hand washing. It's simple. It's 20 seconds or more.
Okay. So we're still learning exactly how easily this is transmitted, right? We don't know how long it stays on surfaces or anything.
But we know it does.
Yeah. I've heard concerns about well, should I be worried about products from China being shipped over here? Is there anything to that, like a shipment from China? You know, should you be concerned?